Hi, my name is Lyana.
Hi,
I'm the nurse practitioner in today, and I'll be doing your head-to-toe assessment. And what is your name?
my name is Denise.
And when is your date of birth?
November 26, 1993.
Okay, so first I'm going to perform some hand hygiene. And basically today, head to toe just means I'll be looking at your hair all the way to your toes, going through all the major systems like cardiovascular, lungs, your skin, neuro, etc. If you have any questions along the way, please let me know. First, I'm going to ensure your privacy by closing this one and making sure the door is closed. Okay, skin. So your skin color seems to match your ethnicity. Also, I don't see any pallor, cyanosis, erythema, or anything of that sort. I'm also looking at the texture of your skin. So I see that it's smooth. I don't see any excessive moisture or dryness or any eczema of that kind. I'm going to check your legs as well. Same goes with the color. Smooth, not dry or anything. Now I'm also going to check for tenting or skin trigger. No tenting, bilaterally in the upper and lower extremities. And I'm looking for lesions. I don't see any birthmarks. I see some scattered freckles here and there, and I would educate the patient to keep an eye on that for changes. And that's it for skin. Nails. All right, so I'm looking at the color of your nails. I see that they're nice and pink, nice, slightly rounded, no clubbing. All right, so now I'm gonna check your toes. I'm also looking at the contour of the nail, nice and pink. I'm also gonna check capillary refill while I'm here, less than 2 seconds. No clubbing of any kind, no lesions. I'm also looking at for pitting, which I don't see, smooth contour, and her nails overall look healthy. Now her hair. Her hair is nice and thick, straight. I'm looking, she doesn't seem to have any hair loss of any kind. Checking the scalp, I don't see any pests, I don't see any signs of dandruff. Nice, smooth scalp, no lesions of any sorts. And definitely no excessive oiliness or thinness. Now we're assessing your head, and I'm looking at the shape of your head, and I see that it's normocephalic, it's symmetric. I'm also looking for any masses or lesions. And have you noticed any tenderness in your head at all? No tenderness? Okay. Now moving on to your face. You have an appropriate facial expressions throughout the assessment. I don't see any involuntary movements of your face. It's nice and symmetric. I don't see any edema or masses anywhere. Now we're going to assess cranial nerve 5, which is just basically your jaw movement. So can you please clench your jaw for me? Do you have any tenderness here?
No.
And can you move your jaw from side to side like this? Good, so that's nice and intact. And now we're going to assess cranial nerve 5 sensory. So just close your eyes for me and let me know if this is soft or sharp.
Soft, soft, sharp, sharp, soft.
Okay, good. So that is nice and intact as well. And for the corneal reflex, I would just get a cotton ball, put it close to her cornea, and the appropriate reflex would be to blink. Now, cranial nerve 7, please smile for me. Nice and symmetric, perfect. I don't see any weakness on one side of the face. And that is it. Okay, now we're going to assess your sinuses. So first we're going to start off with the frontal. So it's going to be just pressure here. Do you feel any tenderness?
No.
How about here?
No.
Okay, good. Do you suffer from sinus conditions or allergies or anything of that sort? Good. Okay, then I see. Now we're going on with the vision testing. So now we're going to test cranial nerve 2. And using this Snellen chart, I'm going to go around 6 feet because it is a smaller one. And can you just read for me the smallest line that you're able to see?
Yeah, FEZPDT.
Perfect. So you have 20/20 vision. Okay, now we're going to assess the visual field. So just look at my nose and let me know when my fingers appear in your visual field.
Now.
Okay, good. So that is intact. Now I'm looking at your eyebrows and your lashes. They're present. I don't see any hair loss. I don't see any lesions or anything abnormal there. Looking at your eyelids, I don't see any ptosis or weakness of any sort. I don't see any signs of inflammation, like styes or anything of that kind. Now I'm looking at your lacrimal ducts. And do you have any burning or any issues with them in the corners of your eyes? No? Okay, they're clear, no signs of discharge or inflammation. Looking at your conjunctiva. you have any pain in there?
No.
Okay, so it's nice and pink, no redness or irritation, no jaundice or lesions of any kind. Good, nice and healthy. Okay, now we're moving on to the sclera. So looking at your sclera, I see that they're nice and white. I don't see any irritation or inflammation or jaundice or anything of that kind. Now moving on to the cornea, I'm gonna look around here. I don't see any opacity, which would occur in cataracts. Yes, so no opacity of the cornea. Looking at your iris, I see that they're dark brown. I don't see any changes in pigmentation. I don't see any shadows or lesions or anything abnormal there. Looking at the pupils, they are symmetric, they're round. The size is 3 to 5 millimeters at a resting rate or in a resting state. Okay, so now we're doing pupils, and I would turn off the lights, but for the sake of the video, we're gonna leave them on. So here's my flashlight. Just look at my nose. Okay, they're round, they're reactive to light. They're equal round reactive to light, and now I'm going to test for accommodation. So if you could just look far away, maybe behind me at the TV over there, and then look at my nose. Okay, accommodation is intact. So perla would be intact for this patient. Moving to the test cranium, there's 3, 4, and 6. So just looking at this red tip, keep your head straight and just use your eyes. Follow it in. Okay, so 3, 4, and 6 are intact, and her convergence is also intact. That she was able to follow it all the way through. All right. Also, I don't see any nystagmus or lid lag, which is good. Okay, so I had just tested convergence when it went back in, and that was intact. Now we're going to look at the red light reflex. And this would also be done with the lights turned off, but for the sake of the video, we're going to leave the light on. So first, let me turn this on. Okay. It's present. And present. So it's present bilaterally. Okay, so while I was looking in there, I also noticed that the optic disc is flat with sharp margins. The color is creamy yellow-orange and it's round. Also, when I was looking in her eye, I saw that the physiologic cup is a brighter yellow-white than the rest of the disc. And it is also less than half of the disc diameter, which is the norm. I did not notice any papilledema. Alright, also, the arteries were brighter red than the veins. I did not notice any AV nicking or lesions. Also, vessels were present in all the quadrants without crossing defects. Okay, Denise, now we're moving on to the ear examination, alright? So I'm looking at your ears right now, and they are symmetric, and they are in line with your eyes. I don't see any masses, lesions. And tell me, do you have any tenderness on your ear in the outer aspect here?
No.
Okay. So now I'm just going to tug on your ear. Does this hurt?
No.
How about downwards?
No.
I'm going to push down on the tragus. Does this hurt?
No.
Okay, now on the other side. Does this hurt?
No.
Or this?
No.
And how about this?
No.
Okay, good. So now I'm just looking at the ear canal. I'm going to flash a light in there. Okay, so I'm looking at the ear canal, and I don't see any discharge, swelling, no foreign body or cerumen. And the same on that side. Okay, so I'm gonna clean these. Okay, so now I'm gonna look at your tympanic membrane. Let me do this side, so you can see. Okay, so put your head forward. Perfect, thank you. I'm just gonna pull your ear up and back. Okay, and then the other ear. All right, so when I'm looking inside, the tympanic membrane is pearly gray translucent, the way it should be. I saw the landmarks, they're intact. No perforations, no bulging. The cone of light was also present bilaterally. So that's a normal ear test for you. That's great. All right, so now we're going to do the whisper test to assess your cranial nerve 8. So I'm just going to stand here and let me know, and close your eyes. Well, actually, I'll just stand behind you. And let me know what word I'm saying. Cow.
Cow.
Yes. And over here?
House.
Yes. So cranial 8, whisper test intact. So if it were to be negative, we would move on to the Weber and Rhine, but for the sake of the video, we're going to move on there anyways. So Weber is about lateralization. So I'm going to hit the tuning fork on my hand, make it vibrate, put it at the top of your head, and you're going to tell me which side you hear it louder in, or if you hear it equally on both sides. Oops.
I hear it equally.
Okay, so Weber, midline. Now we're moving on to Rhine. This test lets us know if you have a higher air conduction or bone conduction of sound. And air conduction should be louder than bone conduction. So first I'm going to hit it again, make it vibrate, put it on your bony mastoid process, and you're going to let me know when the sound stops. And when it stops, I'll put it close to your ear like this, and you're going to tell me if you can still hear it. I'll guide you throughout the process so you're not confused. Start on this side. So let me know when the sound stops. Move here so that we can catch it.
Stop.
Do you still hear it?
Yes.
Okay. Now on the other side.
Stop.
Let me know when this sound ends.
I hear it. Stop.
Okay. So air conduction louder than bone conduction, which is the way it should be. Okay, then I see. Now we're going on to the nose assessment. So looking at your nose, it's very symmetric. No deformities, masses, or lesions or inflammation of the exterior nose. Now we're going to test for airway patency, okay? So I'm just going to push down on your nose and just breathe in. And breathe out. Good. Nice and patent. And the other side. Good. Nice and patent. And was there any tenderness when I was pushing down on your nose? Okay, good. So now we're just going to take this and we're just going to look inside just for the turbinates. Just looking, touching a light. Okay, so the turbinates are pink, intact, smooth. I didn't see any masses, lesions, or inflammation of any kind. Okay, now we're going to look, so I'll get you a clean speculum. So using the largest one we have, we're going to look inside the nose. Okay. Okay. Sorry, is that painful?
No.
Okay, so looking inside, I saw no swelling, signs of bleeding, exudates, polyps. It was pink, not red or inflamed. And also, I did not see any signs of nasal septum deviation, inflammation, or any kind of perforation. Okay, so now we're going to move on to cranial nerve 1 assessment, which is just assessing whether you can smell things or not. All right, so close your eyes. Take a deep breath in. Do you smell something?
Yes.
And how would you describe this smell?
It smells like vanilla.
Okay. And this side?
It smells like vanilla.
Okay, good. So cranial nerve 1 is intact. Okay, so now the mouth and pharynx assessment. Looking at your lips, I don't see any cracking, lumps. It's pink and moist. Okay, so now I'm going to look inside to check the oral mucosa. That's my flashlight. Okay, open wide for me. Okay, so while I'm here looking at the oral mucosa, I'm looking at the gums. Looking at the tickle E for me. Okay, so now what I would document. So the oral mucosa is pink. There's no ulcerations, no white patches, no nodules. The gums are pink, no swelling, no ulcerations. The teeth were white with good dentition. There were no loose or missing teeth, and there were no fillings that I noted. Okay, so now we're going to assess cranial nerve 9, which is your swallowing and rising of palate reflex or capabilities. So if you could please swallow for me. You can do that without any difficulty or pain?
Yeah.
Okay, good. And now if you can just go for me. Hold on, let me get my flashlight again. Okay. Okay, and that does rise. The rising of the palate is intact, so cranial nerve 9 is intact. So now can you please raise your tongue for me? Go, yeah, like that. Okay. Looking inside her mouth, I see it's nice and moist. And you do feel like you have excessive dry mouth or anything like that?
No.
Okay, good. So the salivary ducts don't seem to have any obstruction, and she has a good amount of moisture in her mouth. Now I'm going to assess the tonsils. So if you go for me. They are small with no exudates or sense inflammation. Okay, then I see. So now we're going to assess your neck. And first we're going to assess the cranial nerve 11. Please shrug your shoulders for me. Okay, good resistance. Move your neck for me, round and around. Do you feel any tenderness?
No.
Any rigidity?
No.
Okay, so her neck is supple. She has a full range of motion, no pain. Now I'm going to assess your thyroid. Okay, tilt your head back. I'm looking for any the bulging of the thyroid, which I don't see. So now I'm going to go behind you. Here's your water. And just take one sip of water for me as I palpate the thyroid, okay? Okay, and the other side. Okay, good. And the thyroid doesn't seem to be enlarging or anything like that. Also, now I'm going to listen for bruits using the bell of my stethoscope. Okay, no bruits were auscultated. Her trachea is a midline, and I'm just going to palpate the carotid artery. 2+ bilaterally. 2+. Okay, now moving on to the lymph nodes. Preauricular, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, and like this for me, like that. Well, relax. Okay, perfect. Thank you. Supraclavicular, and now epitrochlear. Okay, so no lymphadenopathy was noted, and was any of that tender?
No.
And no tender. So now we're moving on with the anterior sitting chest assessment. So first thing, I'm assessing your chest looking at your skin. I don't see any skin lesions. Have you noticed any skin lesions or anything abnormal in your chest? Okay, so I don't see that. It's symmetric. So now I'm going to assess your respiratory rhythm. And by looking at you, I can tell that it's unlabored and that it's regular. And I'm just going to assess your respirations. All right, 15 breaths per minute, and that is within the norm. All right, so now I'm going to take a listen to your breath sounds. Just going to auscultate your interior chest using the diaphragm of my stethoscope. Take a deep breath for me. Okay, I heard vesicular breath sounds, and I did not hear any adventitious breath sounds, so that is good. And I did a nice ladder-like pattern when I auscultated. Okay, so now looking at your anterior posterior diameter, your AP diameter, I said it is less than your transverse diameter, which is the norm. So no barrel chested is noted. No barrel chest is noted. And I also don't see any chest deformities, as the chest is symmetric. And I'm going to palpate the chest. Do you have any tenderness?
No.
No tenderness is noted on the patient, and no crepitus. Okay, thank you. So now we're moving on to the posterior chest. So if you could probably, I'll stand here so the camera can get it. Okay. All right, so now we're moving on with the posterior chest. Looking at the skin, we'll pretend that her whole back is exposed, but I don't see any lesions or scars on her back. I'm going to assess her scoliosis by looking at her shoulders. It's nice and symmetric the way it should be. Then I'm going to have her bend over, thank you. And from this angle, you look at the shoulders, and you can also look at the hips, and that they are nice and symmetric. so that her spinal curvature is normal and symmetric. And did you notice any pain?
No.
Okay, so and no tenderness. All right, so now I'm going to perform tactile fermenters on your posterior back. So please, I'll sit here so you can see as well. Okay, so say 99 for me.
Okay, 99, 99, 99.
That is a normal tactile fermentus. It wasn't increased nor decreased. Now I'm going to auscultate the posterior chest in a nice ladder pattern using the diaphragm of my stethoscope. Breathe in for me. Good. So nice vesicular sounds. They were clear and no adventitious sounds were heard. All right, Denise. So can I please have you lay down?
Sure.
Thank you. Now we're going to assess your anterior chest, supine, for the cardiac assessment. Okay, so first thing, so the camera can see what we're doing, I'm going to palpate your chest and all those areas. So it's here, here. I'm checking for heaves, thrills, and lifts. And I don't feel any of that. Now I'm going to palpate for the PMI, the point of maximal impulse. And that normally is on the left midclavicular line at the fifth intercostal space, so usually right under the breast where the underwire of the bra sits. And I feel it right there, and it's about 2 centimeters. Okay, so I'm going to IV and auscultate the 4 main cardiac areas. Okay. First using the diaphragm of my stethoscope, and then I'll go back up using the bell to catch any murmurs. So this is aortic, pulmonic, tricuspid, and mitral. Now we're going to go back up using the bell. All right. So S1 and S2 are normal, no extra heart sounds were heard, and also no murmurs. All right. So now we are at the abdominal assessment in IC. So I'm going to pull up your shirt, and now I'm just looking at the contour of your abdomen. It's flat, symmetric, no apparent masses, pulsations, or peristalsis. Looking at your skin, I see that it's smooth. No scars, striae, lesions, rashes, or dilated veins. Now I'm going to assess for hernias. So if you can please just lift your head and neck, your head and shoulders off the table, and I'm going to look for any bulges. Okay, no hernias, no ventral hernias are noted. Now I'm going to assess your bowel sounds using the diaphragm of my stethoscope. I'm going to listen in all 4 quadrants. Her bowel sounds are hypoactive, which is actually an abnormal finding. Okay, now we are going to auscultate the 4 areas, the aortic, renal, iliac, and femoral, using the bell of my stethoscope for bruits. So first aortic, then renal, then iliac, and then femoral. Okay, no bruits were noted in these areas. All right, now I'm going to percuss the abdomen, and normally we should find a tympanic percussion. If you can hear that, that is a sound of tympany, which is a normal finding. Okay, good. Alright, so now we're going to percuss and palpate the spleen and Schrob space, which will be located on the left side. So, I don't want to do that. Okay. So first I'm going to palpate for the spleen and Schrob space. And usually the spleen is not palpable in healthy adults. Now I'm going to percuss for the spleen. Can you take a deep breath for me? Usually splenic dullness is found in the 10th intercostal space on the left mid-axillary line, and there should be that dullness there instead of that symphony. All right, and I did percuss that dullness sound. All right, now I'm going to palpate the liver, which is in the right upper quadrant, using the hooking technique. So I'm just going to take a deep breath for me. Is there any pain here?
No.
Okay, so the liver seems to have a smooth surface, sharp and regular. No tenderness is noted. All right, so now, we're not done. Now we're going to palpation. So now I'm going to do a light palpation of the abdomen in all 4 quadrants, using one hand. Do you have any pain?
No.
So I don't feel any masses or anything like that, and there is no tenderness. So now I'm going to go a bit deeper. Do you feel any pain?
No.
Okay. I still don't feel any masses, or I don't feel anything of the abnormal. Now I'm going to assess for peritoneal signs using rebound tenderness. So I'm going to push down here. Did that hurt at all, me pushing and me removing my hand? Okay, how about here? No? Okay. So there was no rebound tenderness. Now I'm going to assess for Rosvik sign, which is supposed to detect appendicitis. So I'm going to push down in the left lower quadrant, and if pain is felt in the right lower quadrant, then that's a positive Rosvik sign. Did you feel any pain anywhere?
No.
Okay. So she did not have Rosvik signs. So now we're going to assess the psoas test, which is also to assess appendicitis. So just push your thigh up to my hand. Good. And do you have any pain in your abdomen? So she also does not have the psoas sign. So now we move on to the obturator sign. And for this one, I'm just going to take your leg, and I'm just going to internally rotate it at the knee. So at the hip. Internally rotate it at the hip. So just like this. Do you have any pain in the abdomen?
No.
Okay, perfect. Thank you. All right, and I see we're nearing the end. So we're going to assess your extremities. So looking at your arms, I see that your skin is pink, no lesions, scars, or ulcers. Now I'm going to look at your legs, and I see the same. I don't see any lesions, scars. It's still pink, smooth skin. I'm going to assess the temperature with the back of my hands. Nice and warm bilaterally. Nice and warm, and there's no hair. She's a female and she shaves, so I would explain that. I'm also looking for edema, and I don't see any edema in her upper and her lower extremities, and the feet as well. Now I'm going to assess the pulses. First, I'm going to start with radial. 2 plus, brachial. 2 plus, femoral. That is also 2 plus bilaterally. Popliteal. Behind the knee. Also 2 plus. Dorsalis pedis. 2 plus, and the posterior pedis, which is right here. Also 2 plus. Okay, great. So now we're moving on to the muscle strength, which is rated out of 5. Okay, so for muscle strength, if you can just squeeze my hands. Okay, nice. 5. Now push against my hands. Great. 5. And now, how do I do this? Yeah, flex. Okay, 5. And now push against my hand. Good. And from the back. Good. 5 as well. And with your feet, push. And from behind, flex. Good. 5 throughout. Good muscle strength. Okay, good muscle strength. So now we're moving forward with the last one that I see, your neuro evaluation. Then we're done with the head to toe. All right, so the Nicey clearly has an appropriate mentation. Her mental status is of the norm. She's been speaking with me throughout the entire assessment without any issues. Okay, cranial nerves 1 to 12 are intact as we've assessed previously in the assessment. So now I'm going to assess the cerebellar function with an rapid altering movement. Can you just do this? Okay, good. And now you have to touch your nose and then touch my finger. And I'll be moving my finger. Okay. Good. Okay, that is intact. Now I'm going to assess your gait, which is you walking. So come over here. And first, can you walk on your heels for me? Okay, walk on your heels. Good, nice and stable. Now, can you go back there and then walk on your toes? Good. And now, can you just do tandem walking?
Sure.
Just foot in front of the other. Perfect. So nice and stable, and all of those are intact. You see that she was not wavering, she was not falling over the place. Those were all good. Perfect. Nice erect gait. Now we're doing Romberg. So if you can spread your legs open, put your arms straight ahead, and while we're here, we're also going to assess for the pronator drift. So if you could close your eyes, and as you can see, she's not wavering, she's not stumbling, she's nice and still, and her arms are as well. And you can do like a light push, and you see, they go right back up. And that will be a negative Romberg test. And that would also be, she's negative also for the pronator drift. So now we're moving on with the sensory. So you may sit down now, Denise. Thank you. Get something with a light touch. Okay, Denise. So your upper extremities. I guess you can close your eyes for this. Can you feel this?
Yes.
Is it soft or dull?
It's soft.
Okay. And how about here?
Soft.
And how about your legs? What do you think this is?
Sharp.
Yes. And what about this?
Soft.
Yes. So those are intact, and she answered those correctly. So now we're going forward with the vibration senses. Using a tuning fork, I'm going to hit it against my hand and put it on a bony prominence. Tell me if you feel this.
Yes.
And this.
Yes.
Now put it on your big toe.
Yes. Yes.
Okay, good. So now we're going to do stereognosis, which is basically I'm going to put an object in her hand and she needs to be able to identify it. So please close your eyes. Please tell me what this object is.
It's a hair clip.
Yes, it is. Okay. And now we're going to do graphesthesia, where I'm going to draw a number on your hand using some kind of tool like this, and she has to tell me what number it is. Close your eyes. Okay, good.
2. 1.
Perfect. So now we're going to assess the deep tendon reflexes. And we're going to start with the brachioradialis. So just relax your hands for me. Good. 2 plus. Oh, let me do this one. Good. Moving on to bicep. Oh, nice. 2 plus. And here, 2 plus. So now to tricep, it's actually easier if you just put your arm like this. Nice 2 plus. And over here, 2 plus. So now moving on to the patellar. Should be hanging. Good. 2 plus, bilaterally. Now we're doing Achilles. And it is much easier if you could just turn around and just kneel as if you're kneeling here. Perfect. Now we're going to assess for the Achilles reflex. 2 plus, perfect. And so assessing for Babinski. And that is negative Babinski as her toes curled in and did not fan out. And that is all, Denise. Thank you so much.
Thank you, Lyana.
Nice meeting you.
You've been great.